Welcome to Virtual Grand Rounds. My name is Rachel Bockel, and I'm a first-year medical student at Geisinger Commonwealth School of Medicine in Pennsylvania. And I'm this year's American Academy of Developmental Medicine and Dentistry Virtual Grand Rounds facilitator. For those that are new, Virtual Grand Rounds are a webinar-based presentation model that creates a space for mentorship and exchange of knowledge and experience between seasoned IDD providers, entry-level clinicians, and future healthcare providers in training. The purpose of the Grand Round sessions is to expand and strengthen the IDD healthcare workforce across a spectrum of experience levels. After this meeting, we will be sending out a survey for feedback on how to improve these meetings. And there we go. Please visit our coronavirus page on aadmd.org. It has a lot of information that sources. And I'd also like to mention, you should be able to see 4 polling questions on the bottom left-hand corner, and you may have to scroll a bit to see all 4 of those questions. And then this presentation is made possible through the support of University of Pacific's Arthur A. Dugoni School of Dentistry in San Francisco. I would like to introduce Dr. Alan Wong, our president-elect of AADMD, and is a professor and director of the Advanced Education in General Dentistry residency program at Pacific Dugoni School of Dentistry in San Francisco. He is also one of the 2 global clinical advisors for Special Olympics and will be introducing our featured speaker and special guest.
Thank you very much, Rachel. Excellent. I'm so excited that all of you have logged in tonight and joining us on this COVID-19 with people with IDD, and particularly excited because of the topic. Many of our Special Olympic athletes are wonderful athletes, and they're just dying to get back into it. And you can understand how that affects many of them. So we're able to bring in a wonderful speaker tonight that can give us enlightenment on what's going on as it affects our athletes and our friends with IDD in the Special Olympics. Tonight we are featured Dr. Alicia Bazzano. She's has provided strategic oversight of all health activities around the world to ensure public funding, policies, medical training programs, and health service delivery, and inclusivity for people with intellectual disability. She is a pediatrician by training, public health executive who has dedicated her career to improving health outcomes of people with intellectual disabilities. Prior to joining Special Olympics in 2019, she previously served as a senior medical director for health policy at Acumen LLC and a chief physician at the West Side Regional Center in Los Angeles, which serves individuals with intellectual and developmental disabilities. Dr. Bazzano was deeply involved in the founding of the Achievable Health Center, a first of its kind federally qualified health center dedicated to developmental disabilities, and served as a founding co-chief medical officer there as well. Dr. Bazzano is a faculty member of the UCLA David Geffen School of Medicine, and she previously served as a clinical director for health promotions at the Special Olympics Healthy Athletes in Southern California. Dr. Bazzano completed her medical school and pediatric residency at UCLA, clinical scholar, and was a clinical scholar, selected by the Robert Wood Johnson Foundation. She has completed her master's degree in public health and her doctorate degree in the Department of Health Policy and Management at UCLA. Dr. Bazzano has been appointed to several state and national executive boards, including the American Academy of Developmental Medicine and Dentistry, and served as a Healthcare Leadership Fellow with the California Healthcare Foundation. Well qualified, well trained, and a wealth of knowledge. We welcome Dr. Bazzano to join us tonight to share with us some information, insights with Special Olympics, and she's one of our wonderful AADMD members as well. But to set off this stage, I want to have a very special friend of mine, and he's one of our Special Olympic past global messengers. This is Dustin Plunkett, an accomplished athlete for over 21 years of competition. He's participated in local, regional, national, and world games. He is now an ESPN commentator, works for the Special Olympics Southern California Manager of Outreach. He's a motivational speaker and an advocate, and we welcome Dustin. He has a story to share with us. And Dustin, all yours, buddy.
Thank you, Dr. Wong, and it's a pleasure to be here and a part of this thing. So thank you so much for reaching out to me. As Dr. Wong said, I have been a proud Special Olympics athlete now for almost 24 years. And when I first joined Special Olympics, it was life-changing. And I was found a place where I wouldn't be bullied. I was able to participate. I found my love of sports. But then in 2004, it changed from life-changing to a life-saving organization. And that is because of a program called Healthy Athletes, for those of you who are not familiar with Special Olympics, where it's free health screenings for our athletes, our eyes, our teeth, our hearing, our feet, dietary guidance, fitness tests, to make sure we're the best that we can be when we're out there on the field competing. And then it was in 2004, my coach came up to me and go, "Hey, Dustin, your cheeks are so swollen that you need to go get some medical care right away and get your teeth looked at." And he goes, "Are you in any pain at all?" I'm like, "No, I feel fine." He goes, "Well, at Summer Games this year, you're going to go through Special Smile to get your teeth looked at." And I'm like, as long as they just look at my teeth and don't do any work, I'm fine. The reason why I said this is when I was 10 years old, I had a bad dental experience, and they did a root canal using push pen, causing me so much pain. It ended up shattering one of my teeth. And then I'm like, I cannot have a dentistry work ever again, because dentist equals pain. I don't want to deal with that much pain ever again. And then I went and got my teeth like that, and the volunteer dentist is looking at my teeth and just stops. And he calls my coach over and goes, "Hey, Dustin, you need to go get follow-up care right away, because we don't have the tools to treat you here on site." And it was during this follow-up care, my coach takes me to his personal dentist. I get my teeth looked at, x-rayed. He goes back in the room, looks over at the x-rays, come back in a couple minutes later and says, "Dustin, brace yourself. I got some bad news for you, but don't worry about it. I know how to fix it." And he goes on to tell me that I had gum cancer forming in the upper left side of my mouth. And if it would have just went one more month longer, I wouldn't be alive today, sharing my money to always smile with the world. And that is why Special Olympics went from life-changing to a life-saving organization. And it is because of people like Dr. Wong and everybody on this call with the Special Olympics experience, and especially Dr. Bazzano, which I'm going to toss it over to you.
Thank you, Dustin. You know, I know you, and I've talked to you before, and I can't tell you how inspirational you are to me and to my family, and how important that experience is, and how emblematic of so many people that experience is in going through Healthy Athletes program. And I'm very privileged to be able to, one, work with you, Dustin, and to be able to spend this time with you all, talking to you about the Special Olympics health work that we do, and particularly the response around COVID. And I'll just start off with what is happening right now, because Dustin, you recognize that, and you've shown, and you've told us about your gratitude for what Dr. Wong, others were able to do in Healthy Athletes. And right now around COVID, I don't think that our sense of purpose has ever been stronger. And our sense of the work that we need to do to work for and with people with intellectual disabilities, for their health in COVID, for their health with regard to getting COVID, and for their health and their health needs in general. That sense that if we don't do it, it's not going to happen. And if we don't stand up for it, it's not going to happen, has never, ever been more present. And the understanding that as the world responds, we need to make sure that people with intellectual disabilities are not left behind in COVID. And I'm so happy to be able to tell you a little bit about what we're doing tonight to make sure that happens. If you can go to the next slide. I don't know if everybody here knows about Special Olympics, and I think that still Special Olympics is one of the best kept secrets in healthcare for people with intellectual disabilities. So I'm just going to spend a couple minutes making sure that you have a broader understanding. I will tell you that when I started 8 months ago, I did not understand. And I think people often think of Special Olympics as similar to the Olympics happening every 4 years, instead of the reality, which is that it happens every day. 30,000 competitions a year, 82 competitions a day, 3 competitions an hour. And that it involves over 700,000 athletes in the US alone, over 6 million athletes and participants globally. And in the US, over 100 or close to 120,000 health volunteers and 1,000 athlete leaders. And that not only that, but according to our recent study from last year, nearly 90% of people agree that people with intellectual disabilities should have the same access to healthcare as those without. And 64% agree that people with intellectual disabilities are capable of describing symptoms to a doctor. So these results show that we have a range of attitudes, whereas 91% agree that the Special Olympics training among our volunteers have improved their communication and have helped them become better able to care for patients, people with intellectual disabilities. Next slide. So we know the reason that we do this work in health for intellectual disabilities is because there's a tremendous health disparity. And the way that plays out on a typical US Special Olympics team is that 8 out of 10 athletes, almost 80% or over 80% are overweight or obese. 70% have significant problems with flexibility. 40% need a new prescription for glasses, and 20% have some eye disease. 30% will fail a hearing test. 30% have low bone density. 30% have cavities or untreated tooth decay, and 10% need an urgent referral. Perhaps you did know that, perhaps you didn't, but if you think about the needs, this ends up resulting in these, and the remainder of the health disparities result in an average life expectancy that's 20 years sooner than the general population in the US. And as you potentially also know, most of this or much of this is due to preventable causes. The fact that preventable causes of death, the top 5 for people with intellectual disabilities in the US, at least, include constipation, dehydration, aspiration pneumonia, sepsis. These are all conditions that I think we would all agree, 1, are preventable, and 2, people shouldn't die of. You shouldn't die of constipation. You shouldn't die of choking. You shouldn't die of dehydration. And these are the underlying health conditions that people with intellectual disabilities, these are the underlying causes of death that are certainly preventable that people with intellectual disabilities face every day. We work towards that, and we have worked towards improving that for 20 years or more. Next slide. And we do that every year across the country and across the globe by offering over 1 million health screenings, by capturing health data on, so far, actually close to 60,000 athletes with intellectual disabilities longitudinally, by having over 50,000 participants in year-round health fitness and wellness programming, and by training over 1,000 health messengers who are athlete leaders who share their health journeys and mentor others. We have built the largest data set on the health of people with intellectual disabilities, and we've also been giving athletes the tools to advocate for their own health. And this has never been more important. Next slide. So while we typically absolutely need to work on these issues, we certainly need to be doing so much more now, because people with intellectual disabilities are at increased risk for COVID-19. The CDC has recently added intellectual disabilities to the high-risk categories and has specified, if anybody's following the CDC, certainly has specified a number of health conditions which are considered to be at risk, higher risk. Particularly, people with intellectual disabilities have an underlying lack of access to prevention, to health care. We know this. People with intellectual disabilities also have a higher risk of respiratory disease, of influenza, pneumonia, deaths from pneumonia. And it isn't surprising that therefore there's also a higher risk of COVID as one of those respiratory diseases. However, in addition, there are a number of high-risk conditions that people with intellectual disabilities also have, adding to that risk. Specifically, we've just talked about obesity rates. We've talked about, in addition, there's diabetes, there's heart disease, both congenital and acquired heart disease, higher rates of respiratory illness, higher rates of almost every condition that is on the high-risk conditions list. And combine that with the approximately 30% of people with intellectual disabilities as adults who live in congregate settings, then you very much are additive in terms of the risk. In addition, 80% of health professionals have never been trained on people with intellectual disabilities and how to treat, how to work with them. And as you've probably seen, there are a number of policies and practices that specifically exclude people with intellectual disability from life-saving treatments that required quite a bit of advocacy to ensure that has been changing more recently. So we don't have all of the data that we would like to have. Absolutely. We have seen on a state-by-state basis, for example, in New York, there's a 5 times higher transmission of COVID and a 5 times higher death rate among people with intellectual and developmental disabilities. There are similarly a number of other states, a handful of other states that are coming forth with the data that they have so that we can track them. So we are going to be getting data forthcoming on Maryland, on California, on a number of other states that should be coming out in the next very short while to describe the situation for people with intellectual and developmental disabilities. But we know, and you all know from your own experiences, what is happening to people with intellectual disabilities every day, and certainly what's happening in COVID. And I'll take a moment to just walk you through. Let's say you're a person with intellectual disability and you think you might have symptoms for COVID. First of all, it may be difficult to communicate those symptoms. It may be difficult to describe shortness of breath. If especially dependent on your communication abilities, whether you use verbal communication or whether you use another form of communication. Secondly, you may be in a situation where you don't have a support person who's allowed to be with you. So you're doing this on your own. Next, there is inherently a sense of judgment, a sense of isolation, a sense of stigmatization automatically. And then let's say you're in a healthcare setting where you aren't communicating, you will have anxiety, and that anxiety results in behaviors that are found to be challenging by the healthcare personnel. And those healthcare professionals, like you and me, are very well-meaning, but potentially untrained, not used to working with people with intellectual disabilities in any setting, and harried and very stressed. So to try to understand those symptoms, to take the time to understand the communication techniques, to do all of that in the setting where you have potential self-injurious behaviors, potential aggressive behaviors, and you don't have a support person to assist with that situation is extraordinarily difficult. So that we do not have data, but we know from anecdotes that people with intellectual disabilities are not having as many nasal swabs as they should, as much testing as they should. They're certainly not being prioritized for testing. We know anecdotally that when you go for a nasal swab, getting it for anybody is hard. We heard the President of the United States talk about how difficult that is. And for people with intellectual disabilities who may not be prepared, who may have sensory sensitivities, who may have facial structures which aren't typical, all of those add to the difficulty in doing the testing. And you can imagine that healthcare professional struggling to do it, and whether that testing is valid or not then becomes a serious question. Whether it actually is effective, whether it got to the deep nasal passages that it needed to, whether it did so in a manner that was that will result in an accurate number or an accurate test result. All of that followed by trying to get a chest x-ray, trying to make medical decisions, trying to explain your instructions for response in terms of needing to do home quarantine, what that looks like, how often you check your temperature, how to do that exactly the same time every day or twice a day, how to make sure that you keep face coverings on, and the list goes on. And that's not even if you are in the hospital. So I'd ask you to think about, if you are in the hospital, person with intellectual disabilities, again, communication, having support to make decisions, to know what you are entitled to as a patient. Get much, much more challenging for people with intellectual disabilities and for the health providers who are taking care of them. So what are we doing at Special Olympics to assist and to be the voice of and with people with intellectual disabilities? So first of all, we're doing everything that we can to make sure that people with intellectual disabilities are not being put at risk for COVID, and we're preventing COVID as much as we can. So we have postponed all events and activations with our athletes and all of our travel until June 30th around the globe. In the meantime, we are putting together experts as well as putting together information to make sure that our responses are keeping up to date and are facile with what we need to do. At the same time, making sure that the athletes' health and safety are paramount, and that they are maximizing their participation in any way that they can, so that we prevent social isolation, that we prevent loss of milestones for our children, loss of fitness, and worsening of health outcomes for all of our athletes. So we, within 2 days of having our first athlete involvement with COVID, we had up an infographic, which you can see here. We had up a learning module, which you can find at learn.specialolympics.org. We have been providing the entire movement with frequently asked questions, with our online learning, and with a number of stay-at-home health activities. I have never seen more unity than I have with our Special Olympics movement around COVID. And we are continuing weekly updates, continuing online programming, and continuing our needs assessments, as well as this is part of our work to make sure that we do get training for health professionals and others on caring for people with intellectual disabilities during COVID. Next slide. So our work spans making sure that we are spreading the word, not the virus, in terms of prevention. We also have a number of hand washing videos by and for athletes. We're having the health messengers give prevention messages through their social media channels. And you cannot believe our athlete health leaders, how connected they are with Facebook, with WeChat, with WhatsApp around the world. We have put all of our health work online. Those screenings, the fitness work with 100,000 people, the wellness work, the training work that we do around the world, and our advocacy. All of that we are in the process of, or we have put online. So we are working to make sure that our athletes help stay active, fit, and healthy at home with our ongoing at-home health, wellness, and fitness programming. Our goal is to continue physical activity 3 times a week, to reduce social isolation, and to get the needed preventive care. We're doing that through our fitness programs, online fitness. You can find it every single day, online workouts, workout challenges, and our School of Strength video series with the WWE, which has been wildly popular. Our emotional wellness, again, every day we have emotional wellness challenges to use resilience tools, to use coping strategies, to get support groups available. Our young athletes, our family health forums are also going online. These are a chance for families to connect to each other over a series of forums where families can get information and also connect with each other to support each other during this time on topics ranging from nutrition to hygiene at home to parenting during COVID. We are working towards teaching our coaches and clinicians through our virtual health trainings, and we're working on our work with health training of healthcare professionals with Project ECHO, with our modules on learn.specialolympics.org. We're activating our clinical directors who are our health leaders in each program, each country. And we're working on a community health worker volunteer training that's inclusive, that is going out to up to 1 million health volunteers. And then finally, our advocacy work. We're advocating so that there is an end to discrimination against people with intellectual disabilities, and in particular around COVID care. So working with our programs and our athletes to work on their own self-advocacy, and families to work on advocacy skills, as well as our programs to work on policy advocacy. Next slide. So as I mentioned, we've created a range of health and fitness resources. You can find them at specialolympics.org and look at our work on COVID there. And if you go to the next slide, I particularly want to highlight our Strong Minds work, which is our mental health and emotional wellness work. It's really using positive psychology, and it's a series of resources to help athletes cope with stress. You can see up on the screen our healthy sleep tips, and you can also see a number of resources that incorporate stress reduction techniques. Very soon, we're going to be rolling out our mindfulness stress reduction sessions, which is, I think, very, very powerful and an evidence-based technique for people with intellectual disabilities and their families. We have offline solutions also for both our fitness work, our wellness work, as well as our emotional health work that include cards for activity cards for athletes and families because we know that there are many of our of people with intellectual disabilities around the US and around the world who at this point don't have internet access, computer access, et cetera. So we're finding offline solutions to practice stress reduction at home to keep fitness, as well as our online solutions. Next slide. We are working on our fitness to make sure that everybody is able to stay fit at home. And we had, as I mentioned, School of Strength. So we partnered with the WWE #1 female superstar, Becky Lynch, to do a series of workout videos. And our website on that has received over 100,000 unique page views of those videos. We have directly reached in our campaign over 250 million in the launch of our the campaign in this month alone, or last month, sorry. And on social media, the campaign also reached 13.6 million people. Our fitness work spans the online and the offline. You can see our staying fit work at home with our calendars. We've also partnered with Anytime Fitness to create a series of more advanced online at-home workouts and receive thousands of views of that as well. And as I mentioned, every single day you can get fitness and workouts of various levels, from the very, very beginner from multiple disabilities all the way up through our most advanced athletes on Zoom, on Instagram, on Facebook groups, on WeChat, on so many platforms. Next slide. And we're working with our youngest athletes. So as you can imagine or can think about, we know that there are, I think it's 1 billion children around the globe who are out of school, and certainly millions in the US, and especially in that youngest age group, that those under 7-year-olds who would typically be getting, at least in the US, some sort of early developmental stimulation, early intervention, who are at home with their parents. I don't know if you all know about our Youngest Athletes program, but it is the best kept secret, I think, and the most cost-effective evidence-based early intervention program I've ever seen. For $40 at over an 8-week period, after 8 weeks, our young children, 450,000 of them, develop skills that are 7 months advanced from where they were just 8 weeks ago in terms of their motor skills, their social emotional skills, their adaptive skills, and their parents report improved behaviors. And what we don't want to see is a lack of gains, a stalling of those gains, and certainly not a regression of any of those milestones. So we are working to help those children stay healthy, stay developmentally challenged at home by their families, by providing the Young Athletes program at home, which we're working on both in an online and an offline series. Our work is not only with people with intellectual disabilities, but is by people with intellectual disabilities. And next slide, I will just share with you just a moment of some of the work that people with intellectual disabilities have done. And I'm hoping that this video will work. If you want to try the video. And then I'll finish off. I have just a couple more slides and I'll finish off with our data and where we're going with that, and our work towards health professionals. Maybe it won't work, in which case maybe we can show that at the end.
Yeah, I can put it into my browser and it can work that way if you want to do it that way.
Yeah, why don't we use the slides, and then if you can get it up, that would be great. And if not, then I want to be conscious of time and make sure there's enough time for questions. This is for you guys.
Is this okay?
Yeah. Oh, I'm not sure if we can hear. I know I can't hear.
Is your volume up, Rachel?
I have it through my headphones, but I can
Yeah.
this way. And unfortunately, I don't think the volume's gonna come through.
Let's continue because I just have 4 more slides. If you can go to slide 13. And I want to talk for a moment about data. So we absolutely know that during this pandemic, there's an urgent need for data on people with intellectual disabilities. A number of organizations are starting to collect data, a number of states, as I mentioned. But we still don't know on a national basis how many people with intellectual and developmental disabilities have been affected by the virus, nor do we know how many have passed away from the virus, or what their unique experiences and needs are. There is no standard requirement of what state health departments should include as part of their reporting data on intellectual disabilities. The work that we have done on this is to, first of all, advocate. We have worked with CDC, and a number of us have been working with the high-risk task force on the high-risk task force on coronavirus. So since February, this has been a task force that has included in its purview people with intellectual and developmental disabilities. And when it started out, and when we were invited to the task force, there was no data whatsoever. As a result of advocacy, we were able to get questions from the CDC for each health department when they provide information to the CDC on their cases of COVID. There is a question about whether a person has an intellectual developmental disability. Unfortunately, the state health departments have not been able to, or certainly the CDC has not been able to get enough information from that question to be able to have a uniform understanding of the data. For example, as you can see with race and ethnicity data, it's missing in over 50% of the COVID cases. Similarly, there's not a good understanding of what portion of the IDD question is missing, but certainly from what we understand from our colleagues, it is a very large portion is missing from that data. We know, however, from states that there are a large portion of deaths and a large risk for people with IDD. I already mentioned New York. In Florida, among the 1,364 deaths that have been reported so far, more than 400 have occurred inside long-term care facilities. And it is very, I think that we all from the inside knew that this was going to be very much a firestorm for the spread of COVID. And I think as each week goes on, we can see that more and more. I certainly will continue, and I expect that we will all be continuing to advocate for health data from governments, from state, from federal, from from non-US governments as well. In the meantime, we at Special Olympics are very close to sending out a survey of our athletes around the globe to determine what their experiences are, what their health needs are, how we're meeting them or not. And we're hopeful that that will also provide information as well. Next slide. At the same time, we are developing resources because we know that from this data and from our experiences, it's very clear that there is a lot of work to do for advocating for people with intellectual disabilities. Geez, I'm so sorry. My slides, I think, got flipped. So I will, can we go to slide 15, the next slide, and then come back, circle back to 14? We are working on continuously developing new resources and working with people with intellectual disabilities to work on self-advocacy, because we know that this is such a problem. So we're about to launch an About Me form that helps athletes prepare and plan for a visit to the doctor during COVID. It includes, you can see part of the screenshot of it here, what you should bring to the doctor. It's very visual. What can you expect when you get to the doctor's office? And really attempt to help people with intellectual disabilities be prepared. And we're working on an advocacy toolkit, which includes a number of videos by and for athletes and people with intellectual disabilities, so that they can get themselves prepared for communicating their symptoms, for advocating for a support person being available, for being prepared for getting a nasal swab, getting any kind of testing that they would need, and for knowing what their rights are as a patient. And we certainly expect to roll this out both for athletes and then for families and caregivers as well. If you go back to 14, just the one slide before, we're also working side by side to train health professionals. And there are just some very simple techniques and tips that every healthcare professional can do. Most of them, I recognize that I'm most likely speaking to the choir here. One of them is to communicate clearly. Make sure you're not using any medical jargon or crossword puzzle words that we as health professionals love to use. Two is to ensure that your patient with intellectual disabilities has a support person, either in the room or at worst on the phone, so they feel supported and can make decisions. Third, and this is really one of the most important steps, is to prepare the patient for any COVID-related testing or any associated procedures that might be necessary. The more that we can do that beforehand using our tell, show, do techniques, you tell the person what's going to happen, show the person what's going to happen, and then you do it along with talking a person through it while you're doing it. The last step is equally important, and that's not just aftercare instructions, but really involving the person with intellectual disabilities in all of the decision making, helping your patients to understand the decisions that they're being asked to make, supporting that decision making with family members and with support people, whether it's instructions on quarantine, staying in the hospital, how long do you want the person in quarantine, what social distancing means, how to make sure that you're continuing to get care afterwards. And all of that is going into our free online course, which will be available at learn.specialolympics.org very shortly. And then finally, if you go to the next slide, the one after that, yeah. So just before that, if you don't mind. So even now, we are in the midst of, as you can imagine, moving from Special Olympics, where we are essentially most of the time doing work in person. whether it's our activities on an everyday basis, whether it's our big events, all the way to our biggest events like our World Games. And we are currently and continuing to deliver our programming in all of these areas which we've discussed: prevention and delivery of health screenings and healthcare. So going forward, you're going to be seeing our screenings, our healthy athletes at home, online, our ongoing health and fitness work and wellness work online again, and offline solutions. Our training of our healthcare workforce, which you already have heard about and will be seeing going forward across the globe. And then finally, building partnerships, both for our individual persons with intellectual disabilities and their families, all the way up to the policy level, so that we can continue to change policies, improve those policies to make sure that they're towards inclusion, and improve the health systems in the meantime. We know that health equity has never, ever been more important. And that includes all of the individual level work we do, all the policy level work we do, all the data level work we do, because it's not just me who's saying this, but actually we're very fortunate that even all the way up to Dr. Tedros and former President George W. Bush have said that to protect us all, we need to protect our most vulnerable. And that includes people with intellectual disabilities. So I'll stop there, make sure we have time for questions. Thank you. And I think our last slide, you could probably put up. We're so fortunate that to have the work that we do at Special Olympics Health that's made possible by the Golisano Foundation and the US CDC as well.
Thank you so much, Dr. Bazzano. I just have a few questions to share with you, and I just wanted to remind everyone that if we don't get to your question, it will be posted on the website. So our first question is, can you name the source for the data on transmission of COVID-19 for those with IDD?
So it is on the CDC website, and we can certainly direct you to the particular page on the CDC website with regard to having IDD be a high-risk condition. The New York data is available, and it's also available on just even in the New York Times, but it's widely available as well. The Florida data, again, has been reported in the news as well. So for those of you who have access to PubMed, you can find it there. Otherwise, you can also find it, as you can certainly find it in the news. And we can try to find that for you if you were to need it.
Thank you. And another question is, with the difficulty in testing, do you think the numbers are underestimated?
Yes, absolutely. And that is a serious problem that people have been talking about all over the globe. I don't know that we will actually get accurate numbers until, honestly, in talking to various experts, it's unlikely that we'll get true numbers until after the pandemic is over and we can do serious chart reviews.
All right, thank you. So center-based day services are going to need to change because they are congregate care sites where we won't be able to keep people safe. What can SO do to help transform to more individual services?
Yes, so thank you for that question. It is very much, I think many people are aware that that both the day programs and the group home settings, congregate living settings are problematic because they create more exposure and more risk of COVID. We have been certainly advocating for a number of policies, certainly advocating for priority testing of people with IDD and the people who work with those people, prioritizing PPE for those populations as well. There are a number of recent guidances on CDC's website as well as WHO for dealing with those kinds of situations. And certainly we would espouse the same kind of communication and certainly trying to get that out. And then really thinking outside of the box in terms of what we can do and what we will do, because this is very much a transformational time. Just like it's a transformational time in medicine and healthcare, we are never going to see in the next, certainly not in the next 18 months, and maybe not ever after that, waiting rooms filled with people. We're not going to see a lot of the healthcare and the settings that we've seen, and similarly in the day programs. And it is a tremendous amount of re-envisioning. And I think that we can do that. I think that we're incredibly creative, and that we can see this as an opportunity. Certainly for the young people who are the students and the student chapters at AADMD, you are so well set to think through this and to really carry this forward, to be those voices, because if not you, who? You know the technology, you're there at the forefront of doing this, and you're there because you're passionate advocates for people with intellectual disabilities. So I really actually look forward to working with every single one of you who wants to on looking for those solutions.
Thank you for that. Another question is, is intellectual disabilities as a high-risk category being officially added to the CDC website or printed material?
So it is on the website again, and it's in, I think it's in PDFs too, so it should be able to be downloaded and printed.
Okay. If a family member with IDD is in the hospital, will they let a family caregiver be with them? As I know you hear all the time, the others will be at the bedside alone.
Yes, so we've seen different situations, currently it is very much dependent on the hospital, the health system, and to a certain degree, the state. But I will defer to AADMD because I know that there's a great deal of advocacy going forth to see if we can change that. Alan, I don't know if you want to take that.
I'd love to take that. Thank you. A great lead in. On our website, we have two outstanding petitions. One is to have the right of a visitor or for hospital visits to have a caregiver with our friends with special needs. That's petitions on our website. It has helped to produce some wonderful results. State of California has made that law possible, as well as 5 or 6 other states. So I invite everyone here to go sign up your petition, spread it to everyone else, and make that change throughout the country. And so, yes, that is one. And the other one is the right to be given the opportunity to have a ventilator and not be denied that for intellectual disability. So we have 2 petitions that are going on, and we as AADMD are actively circulating that and trying to help advocate and make changes. And I'm going to take this opportunity one at this moment now, as advocacy is so important in this COVID crisis. We have a wonderful speaker coming up in our next Part 4 series, Dr. Rick Rader. He will be hosting one on When Things Keep You Up at Night, Lessons from a Seasoned Advocate. And he has some pearls of wisdom for us in 2 weeks on the 19th also. So thank you for that time.
Thanks, Alan. Rachel, if you don't mind, I actually have a call to action for all of you on the phone, on the webinar. Just if you are able to advocate, if you have worked Special Olympics before, if you haven't worked with Special Olympics before, all of the work that we're doing, we need support for. So if you are interested in helping our athletes stay safe, stay healthy, prevent COVID, we are looking at looking towards you as healthcare providers, as healthcare students and professionals, to get involved with our work online, because we have given 1 million health screenings. we are working towards fitness for 100,000 people in the US. And we need your help to be able to do that, to be able to transform this year to online, to be able to assist with all of the work that we've been doing. So please reach out. As you mentioned, Alan, you are a global clinical advisor for our Special Smiles program. You can reach directly out to me. You can reach out to our communication staff. Rachel, I'm volunteering you, but you can certainly also reach out to any of us in the different areas at Special Olympics. We would really, really appreciate your assistance in this. And don't think that your role is small. It's what's going to propel us forward.
Thank you very much, Dr. Bazzano and Dustin. Thank you for hosting a wonderful webinar for us and letting us know the wonderful things that are going on in Special Olympics. I know there's many, many great challenges, and it's that attitude that Eunice Kennedy Shriver always said, it's not what you can, but what you can do. So what we can do is move forward, work together. I am so impressed with all my friends. I'm looking out in the audience, and it's like romper room where in front, you're too young, Rachel, but romper room, you see my friends from all over. I see global clinical advisors, clinic directors from all over. We have Dr. Reena Kumar from India. Very early morning for you, one of my heroes in things, but we all collaborate. I'd like to invite everyone on this call to join us for the AADMD virtual conference that we're going to be having in June. And we're going to carry this out. We're going to learn more about things in an interdisciplinary fashion and move things forward, because together we can make a difference. And we are here to support Special Olympics. Dr. Bazzano, thank you for all you do. Rachel, thank you for being a wonderful chair for the student resident group for virtual grand rounds. Do you have any last comments, Rachel?
No, but I really appreciated your call to action, Dr. Bazzano. I think it's really important that us as medical students are also on the forefront of this change that we need right now.
And don't forget, in 2 weeks, Dr. Rick Rader for advocacy. So if you want to learn wisdom from a very seasoned pro, he's here to share all his secrets. All right. Take care, everyone. Stay healthy. Thank you for joining us tonight.
Thank you.
Thank you.
All right, everyone.